Well, welcome everyone. We'll go ahead and get started since we're trying to keep our capital chats to 30 minutes and we have a lot to talk about. Um, since it's the eve of spring break for many people, we're doing something fun today and just having everyone put what they're doing for spring break in the chat. So feel free to share with us. We'll have some fun with that. And then by the end of this meeting, we're going to have one more thing for you to do on your spring break. So get ready for that. So thanks for sharing. And I'm going to turn it right over to Amy. We got, as I said, a lot to talk about today. And we're going to be talking about money for a good portion of it. So take it away, Amy. I guess I didn't introduce myself. I'm Carlin Crow with Iowa DD Council, and I will turn it over to Amy Campbell, our public policy consultant.
Hi, everyone. I'm glad to see you guys are having fun on spring break while Carlin and I get to hang out at the Capitol. Probably don't even see the sun. Right away, I just wanted to give everybody a heads up that we have a new legislator. It is Representative Blaine Watkins. This is House District 100. I think you probably recall that Representative Martin Graber died suddenly of a heart attack, and he represents most of Lee County. It's down in that extreme southeast corner of the state, that district. And Blaine was a clerk for the Senate. He just graduated from Grandview in December, so he's very young. And he will be the newest representative. So that means we get to finally finalize our legislative guide, who represents you. I updated it this morning. It is on the website at that link. However, we're waiting for him to get sworn in and get his committees assigned. And so once we know for sure what committees he'll be serving on, and if there's any other changes with committees, we will get that off to print. And those of you that are members of our network, which I'm assuming you are, if you're on the call, if you're not, you can sign up on our website and you will get a free copy, hard copy of the guide mailed to you. Otherwise, it is going to be on the website anytime you need it. In fact, Carlin and I are working on a plan to try to make it into an app so it's easier. That's just a little preview of what we're thinking about. We just got to find somebody who can do it for free, like a student. But I wanted to move right on to budgets because we do have something to report here. I'm not getting it to advance here. Hold on just a minute. Okay, do you see that? Okay, I don't know what, for whatever reason, my screen just is hiding. Hold on a minute. I had it all set up and then it wasn't advancing. So, of course. Hold on. Well, I'm just going to leave it like that. You're going to see my notes screen. I'm sorry about that. I can't seem to get this to. I have an oh, I don't know what's going on. Okay, well, anyway, the hopefully you can still see this okay. And we will have these posted as well. Oh, maybe I can. No, I don't know. I give up. We have a 3-person revenue estimating conference that meets 3 times a year, and that's because we can only spend what we 99% of what we collect in taxes. So much like your own budgets, we have to spend within a limit. And since we've been doing tax cuts the past few years, the money we collect is going down. Eventually, after this year, that will kind of start to go up again because this is the year we've kind of hit that flat tax rate, so it won't be going down anymore. And so we should start to see money starting to creep up. So it's easiest for me to explain it in a picture. So that first bar is almost $9 billion. B with billion with a B is our current year budget. And you can see the governor's budget is about half a billion dollars more than the current year. And unfortunately, our revenues are down to 8.5 billion. So we're about $1 billion short in revenues to pay for the entire governor's budget. But don't worry, we expected this, and legislators have been saving money to kind of fill in this gap until we get back up to where we need to be with our state tax collections. And so right now, the revenue estimating conference met yesterday, and they said we're good. Everything's as expected. We can still do the governor's budget, but we'll just have to borrow some money from that $3.5 billion we have saved to help fill in the gaps while the tax cuts go into effect. So it's not anything scary. You can see for the next year, it starts to go up again. So what that means is legislators are going to start looking at this. They're going to start coming up with their own targets, how much money they want to spend. I can tell you in the past, usually the Senate goes below the governor's budget and the House goes above it. And then they always end up right around the governor's budget. We don't have cuts in Medicaid program in the governor's budget, so that's good. But there's not a lot of increases either. Most of the increases are just filling in from the loss of extra federal dollars that we had during COVID. So that's, I mean, it's not great news, but it's not bad news, if that makes sense. However, I'm going to turn it over to Carlin, which is a whole other story.
Thanks, Amy. Thanks for that setup. And thanks for making your slides fun with the St. Patrick's Day theme too. So yeah, for those of you celebrating St. Patrick's Day on Monday, happy St. Patrick's Day, or all weekend, or if you're having green beer for spring break. Are you able to advance, Amy?
I'm having a hard time, but I'm going to stop my share and then start again.
Okay. Well, I'll just
It seems to be stuck right now, and I don't know what's going on. So let me start over. There we go.
Yeah, I can start by saying, so today is a big deadline for Congress, as you probably have heard. They need to pass a continuing resolution so that the government doesn't shut down today. And the reason that they need a continuing resolution is because they haven't passed a budget. They haven't even started to agree yet on what a budget will be for the next fiscal year, which would be fiscal year 26, and that for the federal government starts in October of this year. So it needs to pass today. It's passed the House. It's in the Senate. It has to pass by midnight. There's a lot of speculation that it's going to pass, even though there's been calls for not letting it pass and letting the government shut down. And the reason being that nobody wants that to happen usually. But this continuing resolution that passed the House is not a clean continuing resolution, which would mean that it just sets everything the same for the next 6 months. This one makes some big cuts to domestic programs and increases defense spending. So as far as how it might affect us or Medicaid, everything is pretty much the same or close. There's actually some continuing funding for Medicaid under some hospital programs. So it's not all bad. It's just that there are some other things in the continuing resolution that give the administration, the president, some additional power, I guess you would say, over the budget that is concerning to a lot of people. So that's why it's being contested today. So the House budget, though, that is being considered, and we've reported on this a couple of times, is calling for $880 billion in cuts to Medicaid, and that's over 10 years. And again, this is what the budget being considered that would start in October would call for. And the Senate has not even agreed or started their own budget year. They probably started it, but nothing has been announced yet. And as you probably heard, the cuts that are being made across the federal government are being called waste, fraud, and abuse, which is, of course, what we want too. We don't want waste, fraud, and abuse in the Medicaid program, and hopefully they're looking at that carefully. But what the experts are saying is that there's just no way that $888 billion in waste, fraud, and abuse is happening across Medicaid, and even if it's over 10 years. And to break that down, I mean, if you think about it, that's over 10 years, actually 9 years. But let's just say it's, $88 billion a year. You divide that by 50 states. Iowa even could be looking at $1 billion a year in cuts. And what we currently get from the federal government is a little over $6 billion a year. So that would be a huge cut. And we'll look at a graph here quickly too. But this in the House, it has to pass the Energy and Commerce Committee, or that's where they're going to consider it and what those cuts might be. And one of our members of Congress from Iowa, Marionette Miller Meeks, is on that committee. So if you are one of her constituents, please listen carefully and if you can, contact her about your thoughts on that. And the other ways that cuts are being considered, and we've talked about this in other webinars, and Amy's talked about it in Infonet, is either lowering the FMAP, as it's called, which is the percentage of what each state gets, or looking at block grants. That's still kind of being floated. But in any case, any kind of shortfall at the federal level is the states are going to have to make up for it, which means it's going to affect our budget. So even though it might not affect it in the year that's being considered right now in our legislature, it could be coming. So that's why we also want to talk to our state legislators about potential Medicaid cuts and what that could mean. And if you take a look at the next slide, this breaks it down into how many constituents are covered in each congressional district, how many people are on Medicaid that are a constituent of these representatives in the House of Representatives, and what the loss could look like if the $880 billion passes in each of their districts. And this has even been called conservative. So, the way that the cuts would basically be made is fewer people would be on Medicaid. So that's a potential, loss of health insurance, and and for many, their only source of health insurance and supports and services. So this is a chart that we'll have available for you to use if you'd like to use these numbers. If you can reach out to your members of Congress. And that's the action item that we're going to ask you to do this week over spring break, or if it's spring break for you, or if you're working, or maybe this weekend before you go on spring break. It's a great time to reach out to your members of Congress because it's their spring break next week. So most everybody will be home in Iowa. We've seen some town halls pop up already that Senator Grassley's doing, some others, Ashley Hinson has announced. So if they're in your community, it's a great place to meet up with your member of Congress. And this is not meant to cause alarm. You can keep calm and do this, but instead of carrying on, it's a time to take action. So the thing that we're emphasizing is just that we all have a story about Medicaid, and it affects some of us very personally. It's our family member, it's us personally. But the other thing to consider about Medicaid cuts is what it could do to our communities and our economy in Iowa. Huge cuts to Medicaid and Medicare could affect rural hospitals. They could affect community providers. When you consider that Medicaid and Medicare together account for 75% of hospitals' revenues, it doesn't matter what hospital it is, it's around 75%. That could be a huge chunk of revenue that hospitals would not get. And if it's in a rural area and they're already um, in a bad position, this would make it worse. So it would affect our economy in ways that we, don't usually think about when we're talking about how it affects people with disability. So call, write, meet in person, go to public forums, and we just need everybody to say no to Medicaid cuts or tell your story and how Medicaid affects you as a way of showing your support for continuing Medicaid funding as it is. And Dakota has his hand up. Do we want to take questions now, Amy?
Yeah.
Okay, go go ahead, Dakota.
So, my question is, for people to live in ICFID, for example, or for people to live in those slopes, they have to have a consistent funding source coming in before they can usually join the program or the facility. So my question is if they take away that funding, how are they going to be able to fund these places, and how are they going to be able to get the care that these guys need and deserve if this is what happens?
That's a good question. And I mean, unfortunately, we don't know. But unfortunately, what we're hearing from this administration and what their priorities are, the priorities are not home and community-based services. It's almost sounds like they're okay with more institutional settings for people with disabilities who need it. So it would be going in the opposite direction of what we've been going. And so potentially some of that funding could come out of home and community-based services if it's needed for institutions. But we just don't know.
And I think those are good questions to, when you do talk to, if you go to a forum or you send an email to your Congress people, that's a good question to ask them.
Yeah, thanks, Dakota.
Yep.
So everybody add this to your spring break to-do list for next week. The time is really now. And of course, we'll know a little bit more after today what happens with the continuing resolution, but the big budget is yet to come. So I think we're going back to Amy for what's happening in the legislature.
Any other questions about that before we move on? We can circle back at the end here. Okay. Yes, some of you know my kids' Irish dance, competitive Irish dance, so that's why I have to have my Happy St. Patrick's Day stuff up here, but and green's my favorite color. So 4 weeks until the next funnel. We just finished one and there's another one ahead, and 4 weeks goes so fast, guys. I put this little chart together that shows where we were at with the first funnel, had to get out of that first committee. Now we need to get it through one chamber, so either the House or the Senate, and then out of committee on the other side. So it's got to really make it a lot of progress in the next 4 weeks. So that next deadline is April 4th. And then we'll only have a month of session after that. So it's going to go really fast. Really important now to talk to your legislators about any bills that you want to see passed. That includes the Work Without Worry bill. It needs to get out of the House and through the Senate committee. And you'll recall the Senate committee did not vote their bill out. So that'll be challenging. So a lot of work has to be done. They passed about 80 bills this week, so I would expect more next week. I just wanted to also give you some updates on where all the bills are that we've been tracking right now. So the big one, Work Without Worry, has its new bill number, House File 905, and it is ready for the House debate. So House floor means it's ready for the whole House of Representatives to vote on it. And the people listed here are the floor managers. They're the people that present the bill and try to sell it to their colleagues on the floor. So Representative Shannon Lundgren from the Dubuque area is the floor manager of that bill. The seizure safe schools bill are in great shape. They are actually funnel proof because they don't have to go through committee again since they have bills on both the House and Senate floors. And so they are ready to go. Just you don't have to worry about April 4th for them. So it just takes either the House or the Senate to vote it first, and then it goes right to the calendar on the other side. Would be the same with the comprehensive transition programs. Those are those scholarships for things like Reach and Next and Educate, I think is the one at NIAC. And they are not right now in the appropriations committees because they do involve funding, even though it's not listed in the bill. And so they could get a new number when they get voted out of those committees, but they will probably be funnel proof too. You won't have to worry about April 4th with those. Two of the autism bills, House File 330 has passed the House now unanimously, and it is in a ready for the Senate Commerce Committee to vote it out. It passed the subcommittee this week, so it's well on its way to being cleared from that second funnel. And that just requires private insurers pay for autism without any limits. So ABA services are limited right now. This says you can't limit those by age, by number of visits, or by like an annual benefit cap. Similarly, House File 509 does that with Hawkeye, the Children's Health Insurance Program. And that is on the House floor, so ready for the floor debate on the House side. So that needs to get moving. And there will probably be a budget impact to that. Even though technically the state's required to comply with mental health parity, meaning they can't treat mental health conditions differently than physical health. So really shouldn't be putting any limits on that coverage at all. Other big news this week. Yesterday, the House Ways and Means Committee voted out House File 485, which is the bill that was introduced by Representative Turek that makes the purchase of adaptive driving equipment sales tax free, so you wouldn't pay sales tax on it. So if you're in an area where there's a 7% sales tax, that means you could save $700 on a $10,000 lift. So it could add up to some real money there. And got a lot of good support with that bill. Representative David Young, who used to be in Congress, is the floor manager on that. And then the House yesterday passed the bill that kind of tightens up the law around lying about an animal being a service animal. And that passed the House and is over in the Senate right now. It's not been assigned a committee, but I would guess it would be the Senate Judiciary Committee. And really that's just saying you're not going to get a warning if you're lying about a service animal. You're going to get the fine and get charged for that right away. And then there's some other changes, but really just tightening up the law there with that. I also wanted to talk about the other bill that is now funnel proof because it's out of committee on both sides. The Senate bill is in the Senate Appropriations Committee, but it'll get voted out this next week. But we have two bills. Those are the new bill numbers. And I want to make it clear, a lot of people call this the Medicaid work requirement bill. It is not Medicaid. It's only a portion of Medicaid. It's the expansion population. So when the Affordable Care Act passed, this is the adults who otherwise didn't qualify for Medicaid, but were under 133% of the federal poverty level, which is $20,000 for a single person a year. It only applies to that health and wellness program. So that is not a plan that has long-term care services in it. It is the same health insurance plan that state employees get. Children are not in that. They're covered by the Hawkeye program. So it's still 182,000 Iowans. So that's a lot of Iowans in this. And typically in Medicaid, about 75% of Iowans work. And so working age Iowans work. So I'm not sure how much of a benefit a work requirement is, other than adding an extra layer of reporting that you'd have to do. But the House does have 80 hours a month. The Senate just leaves that up to HHS. There's some exceptions, but I want to note that there is not an exception for someone caring for an adult with a disability. So if you have a family member that is your unpaid primary caregiver, and they are on the health and wellness plan, they could lose that unless HHS adds an exception for that. We are trying to get that fixed, including adults with maybe dementia. We have a lot of people my age that are caring for adult parents that have dementia. And then it also increases the marriage assets for the couples assets for the MEPD program, the Medicaid for Employed Persons with Disabilities, which is becoming a barrier to getting married. So they increase that to 21,000. And then the House version includes a study on other states' MEPD program, and looking at maybe the costs or feasibility of expanding our program to maybe be like Work Without Worry, or some other expanded form. And this bill is our bill of the week, not because we think it's a great bill, but because we think it's an important bill that you take action on. A lot of concern about any kind of work requirements, even if it doesn't apply to you. You know, once you do it for one group, maybe it becomes easier to do it for the second group. So I wanted to make a note of that, and that will be available on our website and sent out soon. So again, you can find all of the information we have on our website. And I'm going to stop for 2 minutes of questions or a little bit longer.
Amy, there was a question in the chat about the work requirements bill, the provision that says the health and wellness plan would go away if. Do you want to?
Yeah. So there is there's a trigger in there that if the federal government doesn't approve work requirements, then the whole health and wellness plan goes away. That is in the bill. I'd like that taken out. We'd like to take that out. However, I will just tell you that in our current state plan, health and wellness plan, it also has that in there. So it says that if there's any significant change to the program, like if the federal government were going to change the match rate, that ends the program, or you go to a fallback program. So that's already in our plan to eliminate it, but we don't need it in a second time for sure. But it's putting that in there. So if in 4 years we don't have a Republican president or a different president who doesn't like work requirements, that would just end our whole program entirely. And Dakota, I put that back up there so you could see I think it was 13,000 before. Is that correct, Harlan?
Right.
So not quite doubling it, but definitely better. Well, we're at our time, but does any last questions? Well, I hope you guys all have a great St. Patrick's Day, and a lot of this, I've already posted these slides on the website, and we will get our report out this on Monday morning, and I'll have some of this information in it as well. Hope you take action on Carlin's spring break to-do list. All right, thanks
Thanks.
everybody.
Thanks, everybody. Have a great weekend.